So the starting event, I'm supposed to ask, like, can you introduce yourself?
Yeah, sure. I'm Darlene Burball. I'm the clinical manager at Kama Woodlands Long-Term Care Home. I've worked here for 15 years this December. I'm a registered practical nurse. I actually started working in the hospital where I worked for 8 years. Worked both jobs for 2 years overlapping, and then came here in 2011 and became clinical manager in 2016.
Darlene, what do you think about telemedicine?
I think telemedicine is very helpful. We did kind of touch on it here at CAMA during the pandemic. Our doctors weren't coming in due to a lot of them weren't able to come in, especially specialists and stuff. Our residents couldn't go out, so a lot of our consults and appointments were done either through Zoom calls, through telephone calls, and it worked well during the pandemic for sure.
Did you find it difficult to navigate, to use?
No, I don't think it was very difficult to use. Like I said, we used it through secured Zoom calls and stuff like that. And usually the hospitals or the specialists would send links, and then we would just go into like a private room with the resident or the resident's family, and then we would do the appointment through that, and it worked well.
Do you think it should be used on an everyday or just during pandemics?
I think there's something to be said with people actually going and seeing people in person and seeing the specialists and seeing the doctors. It was an extreme circumstance that none of us ever really thought would ever happen. I don't think I ever thought I would live through a pandemic, but I think going forward, it has its points, it has its time. Say we were in a COVID outbreak, or for whatever reason our residents weren't able to get to the appointments. Some people don't have families, some people don't have ways to get there. So I don't think it's a totally bad, but I think in general it's good for the doctors and to actually see the residents, but there are times when it just isn't feasible. So.
And do you know, like, can you think of any pros or cons? You kind of answered the questions while
Yeah.
you were saying that.
Yeah, the pros are for people that really can't travel or can't get to appointments. We are in a unique situation at CAMA because we are actually classified as being in the Burlington area, and we don't have any kind of transportation that will actually take our residents from Burlington to Hamilton. There's not a straight transportation, so a lot of times it's a huge cost for our residents or their families to get a wheelchair taxi or whatever they need. We are fortunate now that we do have our own bus, so we can get some of these our residents to appointments in Hamilton, but it's very sad that we live so close to Hamilton and we couldn't get there's no real transportation to get our residents there. And cons, like this thing I said before, I think it's sometimes you really need to physically see the resident. We're fortunate now that over the pandemic, we've hired 2 nurse practitioners who are here and work full-time for us. So they're actually seeing our residents on a day-to-day basis and actually consulting with our medical doctor, who's our, he has all of 128 of our residents. So they are seeing day to day. So they are actually being seen. So we're fortunate that way. So.
And lastly, would you feel comfortable yourself taking advice from telehealth or using the telemedicine?
For myself, I think I would feel comfortable. I mean, telehealth, I know I have had some coworkers and stuff that have used telehealth. They're trained nurses at telehealth and telemedicine, trained doctors. I know they have virtual doctor's visits, and sometimes with the strain on the healthcare system, people just can't get family doctors, can't get to even walk-in clinics become overwhelmed, especially during flu season and other times. So I think it serves its purpose. I know that I don't know anybody that's working for it, but they are trained nurses, and I think overlooking the symptoms and trying to figure out for people that are in need and just don't have any other options, I think it's a great system for that.
Thank you for answering all my questions and giving me your own insight on it.
You're welcome.